Most people think high blood pressure announces itself. They expect to feel it, a pounding heartbeat, a throbbing head, some unmistakable alarm that tells them something is wrong. But that's not how it works. High blood pressure earned the nickname the silent killer for a reason. Most of the time, it's doing real damage to your heart, brain, kidneys, and blood vessels while you go about your day feeling completely fine. But here's what concerns me even more than someone who doesn't know they have high blood pressure. It's someone who does know, someone who checks their numbers at the pharmacy, maybe even takes medication, and still misses the subtle warning signs that their pressure has climbed dangerously high. 7 specific signs. Signs that look like ordinary aging. Signs your doctor may never have mentioned. And missing even one of them could mean the difference between catching a crisis early and ending up in an emergency room. Stay with me because by the end of this video, you'll know exactly what to look for, what it means, and what to do the moment you notice it. I'm Dr. Sarah Mitchell, and what you just heard is exactly why I wrote the Blood Pressure Protocol, a complete 180-page guide with a full chapter dedicated to reading your body's early warning signals, including a morning check protocol your doctor almost certainly has never walked you through. You'll find the link in the description below. If you want honest, research-backed health information designed specifically for people over 60, subscribe so you don't miss what's coming next. Now let's get into these 7 warning signs, starting with the one most people completely overlook. The first sign is morning headaches, but not the kind you're probably imagining. Most people think a high blood pressure headache would feel like a full-blown migraine, blinding pain that forces you to bed. The warning sign we're talking about is far subtler. It's a dull, heavy pressure at the back of your head or the base of your skull. It's there when you wake up, and it tends to ease off within an hour or two of getting up and moving around. Many seniors chalk this up to sleeping in an awkward position or just getting older, and that's a dangerous assumption. Research published in the Journal of Human Hypertension found that morning blood pressure surges are significantly more dangerous than elevated readings taken later in the day. Blood pressure naturally spikes in the early hours as your body transitions from sleep to wakefulness. In people with uncontrolled hypertension, this surge can push readings 30 to 40 points higher than their afternoon numbers. That back of the head heaviness is your body's way of signaling something is wrong. If this has been happening more than twice a week, write that down and tell your doctor at your next visit. Comment below right now. Have you been waking up with that kind of morning pressure at the back of your head? Even if it goes away quickly, I want to know how many of you are experiencing this. The second warning sign gets dismissed constantly as just getting older, and that's episodes of sudden dizziness or a tilting sensation, especially ones that happen without an obvious trigger. Now, dizziness when standing up quickly has a separate cause called orthostatic hypotension, where pressure drops too fast on rising. But dizziness happens while you're already seated, while walking, without any clear reason. That can signal erratic blood pressure fluctuation. An erratic fluctuation is actually more dangerous than a consistently elevated reading. A 2021 study from the American Heart Association found that blood pressure variability significantly increases stroke and cardiovascular risk in adults over 65. If you're experiencing unexplained lightheadedness or brief spells where things seem slightly off balance, that's a pattern worth documenting. The third sign is subtle changes in your vision. Here's what I need you to understand. You're not looking for sudden, complete vision loss. That's an emergency, and you already know to call for help. I'm talking about something quieter. Blurred vision that comes and goes. Brief moments where you see small sparks of light at the edges of your visual field. Episodes where fine print seems harder than usual, not because of normal aging, but in short, temporary bursts. These can indicate hypertensive retinopathy, damage to the blood vessels in the back of your eye caused by persistently elevated pressure. Your eyes are one of the few places where doctors can actually look at your blood vessels directly without surgery or imaging. A simple dilated eye exam can reveal vascular damage that might not yet show up anywhere else. If you've been experiencing intermittent vision changes, do not assume it's your glasses prescription. Get your eyes examined and make sure your optometrist knows your blood pressure history. Let me tell you about Eleanor, a 71-year-old retired school teacher who came in convinced she needed new glasses. She'd noticed her vision going slightly blurry in the evenings, then clearing up. She'd already made an eye appointment. But before that visit, she mentioned it during a routine check in. Her blood pressure that morning was 174 over 96. She had no other symptoms, no headache, no chest pain, nothing dramatic. Those brief vision episodes were the only signal her body was sending. We adjusted her treatment plan, and within 6 weeks, her readings were consistently below 140 over 85. The vision changes stopped completely. Moving on to sign number 4, and this is one I want you to pay close attention to: unexplained nosebleeds, particularly ones that happen without a physical cause. You didn't bump your face, the air isn't unusually dry, and this isn't something you've dealt with your whole life. Nosebleeds that begin occurring more frequently in someone who didn't have them before can be the body releasing pressure through one of its most fragile vascular networks. The nasal passages are lined with tiny, delicate blood vessels. When systemic pressure climbs, those vessels are among the first to react. A single nosebleed doesn't mean you're heading for a stroke, but 2 or more in a single month with no clear explanation is a pattern that deserves investigation, not dismissal. Here's what shocked me when I looked at the research for this video. A large population study published in JAMA Internal Medicine found that the majority of adults over 65 who were ultimately diagnosed with significantly elevated blood pressure reported no classic symptoms. But when specifically asked, nearly 40% mentioned either frequent nosebleeds, unexplained fatigue, or changes in sleep quality in the months before their diagnosis. They had warning signs. They just didn't know how to connect them to blood pressure because nobody had ever told them what to look for. That's exactly why this information matters. Sign number 5 is shortness of breath during activities that used to feel effortless. This one is easy to explain away. You're older, you're less active than you used to be. But there's a meaningful difference between being a little winded when you push hard versus finding yourself noticeably short of breath. Climbing one flight of stairs, carrying groceries from the car, or walking from the parking lot to a store entrance. When blood pressure remains elevated over time, the left ventricle of the heart works harder to pump against that resistance. Over months and years, the heart muscle thickens, a process called left ventricular hypertrophy. As the heart thickens, it becomes less efficient at filling with blood between beats. The result is that even modest exertion leaves you breathing harder than the effort warrants. This is not normal aging. If you've noticed a gradual but real change in your exercise tolerance over the past 6 to 12 months, that's a conversation you need to have with your doctor. Don't wait for them to ask. But here's what most people don't realize. This next point may be the most important one in the entire video. Sign number 6 is ringing in the ears, or tinnitus. Now, tinnitus has many causes, and I'm not suggesting that everyone with ear ringing has a blood pressure problem, but here is what's well established in the medical literature. Hypertension is one of the recognized contributors to tinnitus development, particularly when blood pressure spikes acutely. The inner ear is extraordinarily sensitive to changes in blood flow. When arterial pressure is elevated, it can alter the circulation to the tiny structures inside the ear responsible for hearing. A 2020 review in Frontiers in Neurology confirmed a significant association between hypertension and tinnitus severity in adults over 60. If your ear ringing began or noticeably worsened around the same time you were diagnosed with blood pressure issues, or if it tends to intensify during stressful periods, that connection is real and worth raising with your care team. Comment below and tell me, have you been dealing with tinnitus? I genuinely want to understand how many people in this community are experiencing this. The 7th and final warning sign happens at night, and most people have no idea it's connected to their cardiovascular health at all. Poor, fragmented sleep, particularly if it involves loud snoring or moments where you briefly stop breathing, is both a symptom and a cause of elevated blood pressure. Sleep apnea, even mild sleep apnea, triggers repeated stress responses during the night. Each time breathing is disrupted, the body enters a low-grade emergency state, releasing stress hormones that spike blood pressure. This can happen dozens or even hundreds of times a night in someone with untreated apnea. A study from the National Heart, Lung, and Blood Institute found that people with sleep apnea are up to 3 times more likely to develop resistant hypertension, blood pressure that doesn't respond adequately to medication. If your partner mentions that you snore or gasp during sleep, Or if you consistently wake up exhausted despite a full night in bed, ask your doctor about a sleep study. This is not a minor inconvenience. It may be the primary reason your medication isn't working as well as it should. Frank was 68 when his wife finally insisted he see someone about his snoring. He'd been on blood pressure medication for 3 years with readings still hovering around 158/90, despite taking his pills faithfully every day. His doctor ordered a sleep study. The results showed 47 apnea events per hour. Once he was treated with a CPAP device, his blood pressure dropped meaningfully within 90 days, and his doctor was able to reduce his medication dose for the first time since diagnosis. Before I walk you through exactly what to do with all of this, pause for just a moment and honestly ask yourself, how many of these 7 signs have you experienced in the past 3 months? 1, 2, more? Because this next part is critical and I don't want you to miss it. Here's exactly what to do if you recognize yourself in any of these warning signs. First, start keeping a symptom log today. Write down each time you experience any of these 7 signs: the date, the time of day, what you were doing, and how long it lasted. Even if it seems minor, even if it went away quickly. This log becomes enormously valuable when you sit down with your doctor because it transforms vague complaints into specific, traceable data that a physician can act on. Second, check your blood pressure at home using a validated upper arm cuff device, not a wrist cuff. Wrist devices are notoriously inaccurate, particularly in older adults. Check in the morning before eating, drinking coffee, or taking any medication. Sit quietly for 5 minutes first. Take 2 readings spaced 1 minute apart and record both numbers. Do this every morning for at least 2 weeks before your appointment. That's the data your doctor actually needs. Third, and this is non-negotiable, if you experience any of the following, do not wait for a scheduled appointment. Go to an emergency room immediately. A sudden severe headache unlike anything you've had before. Sudden vision loss, sudden numbness or weakness on one side of your body. Chest pain, or extreme shortness of breath while at rest. Those are signs of a hypertensive emergency. For your next scheduled appointment, ask your doctor 3 specific things: whether your current medication provides adequate coverage during the morning surge window, whether you should have a dilated eye exam to assess vascular health, and whether you're a candidate for a sleep apnea screening. If you're unsure how to raise these topics without being dismissed, the blood pressure protocol guide includes word-for-word doctor scripts for exactly these conversations. The link is in the description. And a critical safety note, do not adjust your blood pressure medication doses on your own. Some medications cause dangerous rebound effects if stopped or reduced abruptly. Any changes must happen under medical supervision. High blood pressure doesn't always shout. More often it whispers. Through a morning headache, a brief spell of dizziness, a nosebleed you explained away, a night of fragmented sleep. 7 quiet signals that your body is under pressure it cannot sustain indefinitely. Now you know what they are. Now you know what to do. Comment below with one of 3 things. Comment, watching my mornings, if the morning surge information was new to you. Comment your age and how many of these 7 signs you've personally experienced. This genuinely helps me understand what this community needs most. Or comment sharing this if you're sending this video to someone you're worried about. If this was valuable, please subscribe because next week we're covering something that catches most seniors completely off guard. The 3 common over-the-counter medications that quietly raise your blood pressure without any warning on the label. One of them is sitting in almost every medicine cabinet in America right now. You do not want to miss that one. I'm Dr. Sarah Mitchell. Take care of your heart, stay on top of your numbers, and I'll see you in the next video.